Watch QS24 without ad interruptions on Wikisana, and use the worldwide unique AI search query. Ask your individual health questions and benefit from exclusive programs. Welcome, dear viewers, to our natural medicine format. Cholesterol. There is so much talk about it, the good and the bad of cholesterol. Today we take a look at it from the perspective of holistic medicine. I am looking forward to Alexandra Kotthaus, the head doctor at the BioMed Center Sonnenberg in Schwelbrunn. Stay tuned. Hello, dear Alexandra.
Hello, Sylvia.
Cholesterol is now really an omnipresent topic. We also talk about good and bad cholesterol. Usually only the two values are looked at, but it's much more complex than that. And I'm really curious what you're going to tell us.
Yes, where do I start? Actually, I have to say that I usually only measure the two, total cholesterol and LDL cholesterol. And why do I measure that? Not primarily to obtain information about the vessels. And I'm not one of those people who say about cholesterol, that doesn't matter, that high cholesterol is not bad, and you don't have to lower it artificially. Yes, of course I agree with that. But cholesterol is also a sign that the liver is not doing well and that it has a kind of weakness in metabolizing. So I see elevated cholesterol levels more as an expression of a weakened liver and not primarily as a vascular risk factor. If I want to see vascular risk factors, then values such as homocysteine or lipoprotein A, much more suitable than cholesterol or LDL cholesterol. Only for or against this there is no medication. There are for cholesterol, and even if someone now says, that's always the case with me, it's in my whole family, it doesn't go down for me, then I would almost take a bet that I can lower it. And then some people ask me, what if I use red rice? Don't I have anything against it? But most of the time is not necessary at all. If you treat the causes, and lowering cholesterol at all costs is also a bit like, I always say, breaking off the pointer that says 5 to 12. Cholesterol is not bad per se. And it's more of an expression after an attempt to repair vascular inflammation, which actually has other causes and not high cholesterol. The cholesterol is only stored as an attempt at repair. And if it then increases, calcium is sometimes also stored. So calcium is also a sign of inflammation or of chronic inflammation. And so there are simply several things come together. And you don't just have bad blood vessels or vascular calcification because you have high cholesterol. And the cholesterol in the body, the cholesterol framework. So ARVIDS also has cholesterol, which is measurable in the blood. Most of it is produced by the body itself and not through food. So it's not what we have eaten, but it can certainly be a reaction to the food. And yet most of it is produced by the body itself. And cholesterol is also a natural component of cell membranes. The cholesterol backbone is the basic framework for bile acids and vitamin D and sex hormones and coagulation factors. So the body is, I always say, it has double floors, it is polypragmatic, and it's a good that this exists.
And what happens if you say that you break the pointer if you now take lipid-lowering drugs? What happens then in the system?
I haven't treated the cause of the inflammation. And if you really take a look at the conventional medical figures for statins and lipid-lowering drugs, you can see that the number needed to treat is between 90 and 260 depending on the indication. The number needed to treat means how many people or patients I have to treat in order to do someone any good. or the goal, which I define as doing something good. And if I say depending on the indication, then it's like this. Someone who has never had a stroke or heart attack, a vascular event, I would have to treat 260 people to do them any good. So I treated almost 259 people unnecessarily. And unnecessarily treated would be the kind way of putting it nicely, but I may also have caused people side effects. I know a lot of women who get something like sore muscles with minor exertion, or simply muscle pain, unpleasant pulling in the muscles, which is a typical side effect. And it can also lead to a Q10 and B12 deficiency. And that can then cause other problems in the long term. And then I think to myself, my God, it's so easy to lower cholesterol naturally. And please not now with red rice or something. Then as a biologist, I thought like a conventional doctor or a car mechanic. So that's symptomatic treatment again. You can also treat symptoms with natural substances, or I can treat the causes. And then I've also reduced the vascular inflammation.
And for me, it's also a bit astonishing that when you have so many people with this rate of 259 to 1, that there is even, how should I put it, a justification for medication. Yes, because that's...
It is now being sold as plaque stabilized. So it's, oh, there's already plaque? Then you could take this. Because then nothing comes out of the plaque and causes a vascular occlusion somewhere else later.
Okay, well then, let's leave it at that. That's actually self-explanatory. But when you say, precisely because these are such complex interactions with the liver, with the function of the liver, and with all these levels, where do you start again? Or is there, let's maybe start like this. Is there anything at all for people who now say, okay, I never want to take statin. I want to take a prophylaxis for myself. Is there a prophylaxis that you can take as a healthy person? Yes, with regard to such diseases. It depends on what you want. Do I want to do laboratory cosmetics? Can I do some of it with natural substances? Or do I really want to be healthy and live a long life? And there is no either or. I don't necessarily want to grow old, but dying healthy is a paradox. Many people are not aware of this. Either I live in such a way that I grow old and die healthy, or I die younger and ill. Not I die younger but healthy. That's only if I get run over by a car or have another accident. Yes, okay.
And if someone doesn't want to treat the causes, then they can take red rice for all I care. And if he wants to treat the causes, then he doesn't need to take red rice or can take it temporarily. Artichoke is good. After all, artichoke is a plant. Plants are a lot of mixtures of substances. They usually have several positive effects. Artichoke also has silicon, which is no longer taken in sufficient quantities. But it does not lead to a serious reduction in cholesterol if taken as the sole measure. Of course, the diet plays a role, because I can, of course, eat a very liver-friendly and detoxify. And the liver plays a major role, also in the blood composition. The liver is the eye of the needle in detoxification, and also how quickly I can detoxify. The liver regulates so many different things, from the water balance. It is only regulated to a limited extent regulated by the kidneys, but the liver also plays a major role in various ways. And of course, if the liver works well, I can detoxify well, then no doubt. This naturally also reduces my inflammatory potential in the body. And of course, nutrition plays a major role for the gut. Even if it's doing well, I lower my entire inflammation level in the body and ensure the right exchange of substances.
The environment in the gut is also again co-determined with the liver. And everything plays together, doesn't it?
Yes, I don't like to say, oh, the intestine is responsible for everything. There is also, as I've said before, a whole person is attached to the knee and the intestines too. And it's not just the gut. We are a complex interplay between all the organs, and the upper abdominal organs also play a major role. And how well I digest also depends on the stomach and the pancreas and the liver and bile.
So that simply means liver-friendly diet also means lots of bitter substances, lots of greens, you would say.
Yes, I have even made the experience once. There are people, for these are those bitter substances, almost too much. Yes, and we're already getting detox side effects. That's already happening. So I think you don't necessarily have to overdo it. But greens are certainly something, green leafy vegetables, which the liver likes because it is helpful in several ways. It promotes the microbiome as well as having detoxifying properties, binding properties, as well as supporting the detoxification systems in the liver. The liver is also happy about fruit. Yes, so these are high-quality carbohydrates and not no carbohydrates. And this over-proteinization, that's happening at the moment. Protein is, in my opinion, slowly becoming a madness. It's more of a stress for the liver and hyperacidity. And if I don't eat any carbohydrates, which is becoming more and more fashionable, or eat very little, then the liver still has to produce glucose. Even in the ketosis, which many people do not realize, we do not have a low blood sugar level. We have at least a normal blood sugar level. And the longer the cetosis lasts, the higher the blood sugar level rises. And the dear Creator, whoever designed us, certainly had something in mind when he added insulin to our system. And the insulin probably doesn't only bring glucose into our cells, which our cells really like, just not too much, and from the wrong source, but also minerals. And our brain needs glucose, and the liver produces glucose for this. And if it has to produce more, because we put it into artificial deficiency via too many proteins, then the liver is put under additional strain.
And simply this protein topic, to briefly take up this protein topic because many people on a vegan or vegetarian diet, these fears are also being triggered a bit with this shortage. Would you say that if you eat really well, as you have already explained, with lots of green, with organic products, would you say that the protein requirement is covered?
You can eat a good vegan diet that the protein requirement is covered. I am very much in favor of a plant-based diet, but not explicitly vegan. In fact, I don't even like the word because it causes so much resentment and so many prejudices. And someone who lives vegan can eat badly, incredibly badly, in fact. And there are people who can eat incredibly well in this way. And you can't be all lumped together. And the micro and nutrient deficiencies don't just occur in vegans, but in all people. But it makes sense. A lot of fresh produce, ropes, and vegetables a day. This does not necessarily be all raw, and there are also tricks if you think he is less able to tolerate raw food. But these are the things that help us. There are vitamins in there, and especially minerals. It doesn't make us angry. And then you can eat other things as well. But the ratios between them, they do play a role. And I don't advise everyone the same. Someone who is underweight or who has diabetes, I will give them a different priorities. Yes, but it's not really about vegan. It's about healthy, not militant vegan, and these strange excesses.
Yes, exactly. But simply to put it again, you would say that you can eat a really good natural, plant-based natural diet and you have enough protein.
Yes, that's possible.
Because I just want to say that again, because that's another myth. And there's always the fear that you don't have enough protein, right?
No, you don't. It is even relatively easy to meet the requirement of essential amino acids per day. And in the 1950s, people ate around 45 grams of protein a day. Now we're more like 120 grams, and most people think you need to eat even more protein. And now for a while, the fats were criticized, and then the proteins. And at the moment, it's the carbohydrates. You have to say also how it has turned out with other things in the past. It comes down to, we are designed to eat fats, proteins, and carbohydrates. That's the most normal thing in the world. What's not normal at the moment is the distribution between these things. And the quality and sources, the sources of these substances have to be natural. And many things that look natural at first glance are not natural. When I buy a liter of milk in the supermarket, it's not really what I associate with. This is not just a liter of milk. It is usually homogenized, it's pasteurized. Let's say it's organic. Yes? Then it may not be from high-yielding cows, but organic cows also have to be kept pregnant. Organic cows are also separated early from their calves until, if they are not, then it is usually listed and costs a lot more. So that's just it. Natural also means that I eat food that has not been manipulated and bred. Even if at first glance look like, yes, like wheat, where you assume that's not what it was 70 years ago. When the fields are cultivated to a height so that the combine harvester can harvest it best, so if it's pure breeding, then it's still possible. Even the hybridization of plants doesn't necessarily have to be a bad thing. But if I genetically manipulate it, then it is still a problem.
But you would say other cereal products, if you don't have any intolerances now, are also valuable foods.
Including quinoa and amaranth, even if I have the right combination between potatoes and greens, then I can also get essential amino acids. But these are things, they don't have the high energy density that we are usually used to. And I simply have to eat more of it. And that's something our stomachs are usually not used to. So,
okay, and I have another question about cholesterol, because what I also often hear is that people who actually live very healthily, do high-performance sport, also have elevated levels. Do you have an explanation for this? Because I've heard that several times now.
I don't know, because I'm only marginally involved in high-performance sport. But I wouldn't not be surprised if that's the case, because it's simply enormous stress. We're simply no longer talk about healthy, and many top athletes have joint problems at a relatively young age.
Yes, exactly.
These are not necessarily the people who have the highest life expectancy. We're no longer talking about healthy in high-performance sport. We're talking about people who get a lot out of their bodies in a relatively short lifespan.
And are perhaps also over-acidified, aren't they?
Probably yes. Because especially in the sports scene in particular, the protein is extremely pronounced.
Because that actually surprised me, because I've heard several people who really train excessively, and all of them with... Rainer even said that he has to take statins, and that really surprised me. I thought maybe the explanation somehow lies in hyperacidity, acidification, or whatever, just overstressing the body or what.
Yes, I could well imagine that. As I said, I haven't studied it more intensively, but that there are also repair mechanisms, but also simply an overloading of the liver due to too many proteins. I also had someone who has been on a keto diet for months now, and also had such high cholesterol levels.
Simply because, how would you interpret that?
Overloading the liver.
And how do you see it when people watch the program and have been taking statins for a long time? Because they say that is also quite difficult to stop taking them again? Or how do you see it?
Stopping statins? There are medications that are difficult. No, it's not usually difficult. Yes, as I said, it depends on what they really want. So simply a harmless medication or really want to get better. I also have a patient who has been given a double combination with a fat and a cholesterol-lowering drug. He changed his diet, and he still has incredibly low values now, even several months after stopping this medication.
And did you then change the diet at the same time, and you slowly weaned off? Or did you first change the diet and then the weaning off?
So it also depends a bit on why someone gets it. Someone who has never ever had a cardiovascular event is only taking it because of the cholesterol values. Is there really anything that has been found in the blood vessels? So I just don't like to make such sweeping statements. Or does anyone already have a stand or something like that? I just wouldn't do it ad hoc for everyone, but that would depend on various factors and also what the patient wants and how willing he is to cooperate. So it's not like that now, hey, I can simply replace the conventional medicine medication with something herbal or automolecular. So it's not quite that easy.
Yes, then you just have to be ready for a change of life. And then I have another question, because when I was working as a nurse, the values were all set even higher. For example, the cholesterol levels. And now they are gradually lowered. Is there an explanation for that?
It's a mystery, isn't it? Yes, what can I say to that now? It's the same with blood sugar levels. Let me tell you, I see it from two sides. Certainly, the lower the reform values or reference values are set, the easier it is to prescribe medication. But I don't want to say that all the studies behind them are now faked or are just trying to get more medication prescribed. So I do think that low cholesterol levels or low normal blood pressure or blood sugar levels contribute to a longer and healthier life. Only the reverse conclusion that this is also the case if I create it artificially, I just don't think it's true.
Exactly. I think that's a very important, because people then think, well, okay, now everything is settled. And it really is actually, as you said, the pointer, the indicator is then broken off, isn't it? And I think you explained that very clearly and well today, because there are people keep asking me about it, and I'm not a specialist at all. And I think it's an important topic, as with all topics, that we ourselves as people, and that we really understand ourselves, what it is actually about, and then decide which path we want to take. Once again, it was very informative. Thank you, Alexandra.
Thank you, Sylvia.
Dear viewers, thank you very much for being there. For me, again, important information. I hope you were also able to something for yourself. Stay healthy and see you again.